I was wondering if he was going to end with a joke or be serious, but he's making a point. He's
Yes.
making a point. Always good to have Trevor Noah here. We're going to begin with this, the story about President Trump, who is promising a coronavirus vaccine this year, no matter what his top medical advisors say about it. The president claims that CDC Director, that's Dr. Robert Redfield, misunderstood the question about a COVID vaccine yesterday. Now, Redfield was testifying on Capitol Hill at the time and was asked when a vaccine would be ready for mass distribution.
If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021.
No, I think he made a mistake when he said that. It's just incorrect information. And I called him, and he didn't tell me that. And I think he got the message maybe confused. Maybe it was stated incorrectly.
Redfield also testified that wearing masks may offer better protection for people than a vaccine. Mr. Trump then said Redfield was mistaken about the effectiveness of masks.
Only on CBS This Morning, we are joined now by former CDC Director Dr. Tom Frieden. Dr. Frieden, good morning to you. Exactly the person we want to talk to today. The CDC is considered the gold standard in public health. It's been at the forefront of every prior public health issue in this country. But now with the coronavirus, we've seen it sidelined. There are reports of scientific guidance being revised by political appointees. And now for the second time, you have the president contradicting the head of the CDC. How concerned are you about all this?
Well, we've seen both the FDA and the CDC unduly influenced by politics when it comes to emergency approvals, when it comes to recommendations, and that's very problematic because we want to have a safe, effective, accessible, and trusted vaccine. A vaccine is a really important tool. In public health, we love vaccines, but in order to get people to take it, we've got to be able to trust it, and that means we need complete transparency on the information from the drug companies. That means it needs to go through the standard process of the FDA and the CDC. That can be done quicker, but it has to go through that process. No cutting corners on safety. And when it comes to a vaccine, it's one tool. It's not going to make this virus disappear. There's no fairy tale ending here to the pandemic. If we have a safe and effective vaccine, we should get it out as soon as safely possible. And when we do that, along with masks and hand washing and being more careful and finding and stopping cases and clusters, we can get to a new normal. But it's going to take all of us working together.
There are a lot of questions about the credibility of the CDC at this moment in time. In 2018, when Dr. Redfield took the job, he choked back tears as he vowed to maintain the integrity of the agency as a data-driven science organization. Do you think he's kept his promise?
Well, when I look at things on the CDC website that aren't scientifically justifiable, and were written not at the CDC headquarters in Atlanta, but in Washington by people with no special experience in public health, I look at that as almost like someone vandalizing a national historic monument and writing graffiti on it. And that kind of material on the CDC website should not be there. It's not acceptable. It's unprecedented. It has not happened before. And it's unfortunate because there are thousands of really good documents on that website. It's had 1.6 billion clicks, and we need to be able to trust it.
Yeah, Dr. Frieden, your shot is frozen, but we can still hear you, so we're going to continue. What does Dr. Redfield need to do right now to reassure the American public that politics is not going to influence the information on the CDC website and also the broader vaccine push?
Well, when it comes to the vaccine, what we need to see is going through the FDA Advisory Committee, the CDC Advisory Committee, and when it comes to CDC, they have to have standard guidance that's scientifically proven, and I would really think it'd be even better to hear not just from Dr. Redfield, but from the specialists in the infectious diseases, in the respiratory diseases that this is one of. These are the world's experts on how to control an infectious disease, how to control a respiratory infectious disease. The more we hear from them, the more we can understand what's happening and adjust so that we can work together and keep the virus at bay. There's only one enemy here. It's a virus.
Yeah, one of the things that the president said that Redfield was confused about was about masks, when he said that masks offer more protection than a vaccine. Where do you stand on that?
Well, it's really kind of an apple versus a theoretical orange. On the one hand, masks are really important, and what we've learned clearly is that the more people wear them consistently, the more you can protect everyone. You protect others, and you also probably protect yourself, and maybe even protect yourself from severe illness. So masks are really important. A vaccine, we don't know what the effectiveness is yet. We don't have the studies. No one knows. So we'll have to see what comes back in terms of those studies. But even very good vaccines don't take most diseases off the table. You've still got to do control measures. We need a comprehensive response if we're going to get past this and through it together.
Yeah, but you're standing firm, Dr. Frieden, about the importance of masks. You're standing firm about the importance of masks. I think we have to keep emphasizing that. That's why people are so confused, because they keep getting conflicting messages from people who are not scientists.
Wear a mask, watch your distance, wash your hands. All of those 3 W's are really important. If we do that, we can get back toward a new normal with fewer deaths. Already we have a failed U.S. response. We're hitting 200,000 deaths. Tens of thousands of those deaths didn't have to happen, and millions of lost jobs didn't have to happen if we had had a science